Hi, I'm Linda from Vetster, and in this video, we're going to go over everything you need to know about vomiting in dogs. Don't forget to hit subscribe and check out our other videos. As always, all the information you're about to hear has been meticulously reviewed by leading Vetster veterinarians. All right, let's get into it.
Vomiting in dogs happens when their stomach contents are forcefully expelled through their mouth and nose, often with that unmistakable retching sound. It's an active process involving the abdominal muscles and is considered a symptom rather than a diagnosis. There are numerous reasons why dogs might vomit, ranging from various medical conditions to certain behaviors or situations. Often, it's a mild issue that resolves itself within a day, especially if it's caused by something unusual or irritating they've eaten. However, if the vomiting lasts more than 24 hours, is accompanied by other symptoms, becomes severe, or keeps happening, it's important to consult a veterinarian. Regurgitation in dogs is often mistaken for vomiting, but there's a key difference. Vomiting is an active process with stomach contractions, while regurgitation is passive and doesn't involve these contractions. Instead, it might be accompanied by a burp or a cough rather than a retching sound. Knowing the difference can help a vet make a more accurate diagnosis. Just like vomiting, frequent regurgitation can indicate a health issue that needs to be checked by a vet. Vomiting in dogs can be linked to a variety of behaviors, environmental factors, and medical conditions, ranging from minor to severe. To figure out the cause, a vet will look at the dog's medical history, including their age, vaccination records, past health issues, and living environment. The most common reason dogs vomit is due to dietary indiscretion. They often consume unusual or irritating things like garbage, human food, another pet's food, houseplants, or even foreign objects like clothing or toy stuffing. This behavior is especially common in dogs that explore the world with their mouths or aren't picky eaters. Since dogs can be quite sneaky, they might eat something unusual without their owner's knowledge, leading to vomiting. Dogs sometimes gag on long strands of grass, which can make them vomit. Contrary to popular belief, dogs don't eat grass to make themselves vomit. Most dogs simply enjoy chewing on grass or licking the morning dew off it. This is a natural behavior and generally isn't a cause for concern, even if it occasionally leads to vomiting. If you'd like to know more about dogs eating grass, check the related video linked below. Vomiting is a common symptom in a variety of illnesses and chronic medical conditions in dogs. Some of these conditions include pancreatitis, viral or bacterial infections, bloat or GDV, kidney failure or liver disease, stomach ulcers, bilious vomiting syndrome, inflammatory bowel disease, diabetes, cancer, or medication side effects. When vomiting is due to an underlying illness, it often lasts more than 24 hours and is usually accompanied by other symptoms like diarrhea, lethargy, or loss of appetite. In such cases, it's crucial to visit a veterinarian quickly to diagnose or rule out serious conditions and to get the necessary treatment. Pancreatitis is fairly common in dogs and is often triggered by eating garbage or large amounts of fatty foods. Dogs can develop pancreatitis and gain weight from consuming human food, especially if they get table scraps or manage to snag food from the counter. While there's no single treatment for pancreatitis, it often requires a hospital stay to manage the condition. Infectious diseases like parvovirus and distemper are highly contagious, especially for young puppies and unvaccinated dogs. Parvovirus in particular is common and can be deadly, with about 10% of affected puppies not surviving even with prompt treatment. This highlights the importance of routine vaccinations. If a puppy starts having severe vomiting, especially with symptoms like bloody diarrhea, lethargy, and loss of appetite, it's crucial to see a veterinarian immediately. Medications used for non-digestive issues, such as antibiotics for a skin infection, can sometimes cause stomach upset in dogs. It can be tricky to determine if vomiting is due to the medication, so it's important to consult your vet if your dog develops an upset stomach while on medication. Do not stop giving the medication unless your vet advises you to do so. Many dogs, particularly those who quickly eat anything that looks appealing, can end up ingesting something that upsets their stomach. Some might even overeat their regular food. Common dietary causes of vomiting include overeating or drinking, sudden diet change, food intolerance or allergy, eating spoiled food, foreign bodies. Dogs that eat or drink too quickly can also end up vomiting. Offering smaller, more frequent meals can help prevent this. Eating an unusually large meal too fast can lead to food bloat, which makes the stomach stretch much more than normal. This often happens when a dog gets into a large bag of dog food and eats a huge amount. Vomiting can also result from abruptly changing a dog's food, a food allergy or intolerance, or eating spoiled food. If you need to change your dog's diet, do it gradually by mixing the new food with the old food, slowly phasing out the original diet to avoid stomach upset. Be cautious when feeding raw diets or allowing dogs to consume prey animals. Raw diets have a higher risk of food poisoning compared to canned or dry dog food. Wildlife can also carry bacteria, parasites, and other elements like bones, fur, and feathers that might cause vomiting. Always check the expiration date on dog food before feeding to ensure it's safe and fresh. Dogs with food sensitivities may experience frequent vomiting and stomach upset due to certain ingredients in their food. Diagnosing food allergies and intolerances can be challenging and often requires a lengthy process of trial and error with different foods and ingredients. Virtual veterinary appointments on Vetster are ideal for nutrition consultations and getting expert advice on making informed food choices. You might also consider scheduling a consultation with a veterinary nutritionist, a board-certified specialist with extensive training and experience. Factors within a dog's environment, such as toxins, parasites, and the weather, can cause vomiting. Examples include poisons such as antifreeze or rat bait, motion sickness, overstimulation, internal parasites, and heat stroke. Poisons and toxins, like rat bait and certain human foods and medications, can cause severe or bloody vomiting in dogs. It's common for dogs to accidentally ingest human medications found in many homes, such as ibuprofen and acetaminophen. These drugs are highly toxic to dogs and can lead to severe vomiting and other serious symptoms. Dogs can suffer from motion sickness in moving vehicles, leading to vomiting. Usually, the symptoms stop once the vehicle is no longer moving. However, if your dog continues to feel nauseous and vomits long after a car ride, there might be another issue at play. If you plan to travel with your dog, consider consulting an online veterinarian to see if anti-nausea medications might be a good option for your pet. High temperatures, such as those that can quickly develop inside a hot car, can lead to heat stroke in dogs, causing severe vomiting and other serious symptoms like bloody diarrhea and collapse. To keep your dog safe in hot weather, avoid walking them during the hottest parts of the day. If your dog starts vomiting after being in the heat, take immediate steps to cool them down and contact an emergency veterinary hospital right away, even if no other symptoms are present. While intestinal parasites typically don't cause symptoms in healthy adult dogs, they can sometimes lead to vomiting. Parasites like Giardia, Coccidia, roundworms, tapeworms, and whipworms are easily spread through contaminated soil and water. Regular fecal tests are crucial for detecting and treating these gastrointestinal parasites, preventing their spread to other animals and humans. Additionally, parasite prevention is essential for controlling internal and external infestations, including fleas and heartworms, which affect other body systems. There are different types of vomiting which can be classified based on the duration, severity, and color of the vomit. Vomiting is considered acute when it lasts for a short period, typically no more than a few days. Chronic vomiting persists for longer than a few days or happens repeatedly over time. Both acute and chronic vomiting can signal a serious underlying condition. Vomiting in dogs can vary from mild to severe, depending on the situation. Mild vomiting might occur in a dog that is otherwise active and energetic. Severe vomiting usually comes with other symptoms like lethargy, loss of appetite, and diarrhea. The number of times a dog vomits in a short period isn't a reliable indicator of severity. Often, a dog will keep retching and vomiting until their stomach is empty, regardless of how many times it happens. The color of a dog's vomit can vary and provide clues about its cause. Green, orange, or light brown vomit usually reflects what the dog has recently eaten and may or may not include undigested food. White, foamy vomit often indicates an empty stomach. Yellow bile suggests vomiting from the small intestine and is more common when the stomach is empty. A few spots or small streaks of red blood are typically due to throat irritation from retching and stomach acid. However, large amounts of red blood, very dark vomit, or vomit that looks like coffee grounds indicate severe gastrointestinal bleeding and require immediate veterinary attention. Dog owners should know when to seek veterinary care for their dog's vomiting. It's important to seek medical attention if the vomiting lasts longer than 24 hours. Other symptoms, such as lethargy, diarrhea, appetite loss, or weight loss are also present. The vomiting occurs in a young puppy or a dog with a pre-existing medical issue. Vomiting is considered an emergency if the vomiting is accompanied by labored breathing, a change in gum color, weakness, or collapse. The vomit contains a large amount of red blood, is black, or has a coffee ground appearance. The retching is unproductive or repeatedly produces only a small amount of saliva or foam. The dog is not keeping any food or water down. Foreign body obstructions happen when a dog swallows something indigestible that gets stuck in their digestive tract. Common culprits include corn cobs, socks, and toys. When food can't move through the digestive system due to a blockage, it will be vomited back up. Treatment typically involves endoscopy or abdominal surgery to remove the object. However, the specific treatment can vary based on how long the object has been there, what it's made of, and its location in the digestive tract. Gastric dilation volvulus, GDV, also known as bloat, occurs when a dog's stomach twists on itself. Dogs with GDV often retch without producing anything. This condition progresses quickly, cutting off blood supply to the twisted stomach and other organs. Treatment requires complex and risky abdominal surgery to decompress the stomach and stabilize the dog. Large breeds, especially those with barrel chests, are most at risk, and the risk increases with age. However, any dog can experience bloat, so unproductive retching should never be ignored. So how do veterinarians treat vomiting in dogs? Vomiting is a symptom rather than a disease or diagnosis. To stop the vomiting, it's often necessary to identify and treat the underlying cause. This process includes taking the patient's medical history, performing a physical exam, and conducting diagnostic tests like blood tests, fecal tests, and imaging. These tests are crucial for diagnosing and ruling out more complex causes of vomiting that don't respond to symptomatic treatment. Symptomatic treatment can help relieve nausea and vomiting while the underlying cause is being addressed. A veterinarian might recommend fasting or offering a bland diet, like rice and plain chicken. They may also suggest other dietary changes. However, don't attempt to fast or change your dog's diet without veterinary guidance, as it isn't safe for all dogs. Other treatments a vet might provide include anti-nausea medications or fluid therapy to combat dehydration and replace electrolytes. Never give human medications or drugs not approved for your pet by a veterinarian, as many can be toxic to dogs. Vomiting is common in dogs and isn't always preventable. Some dogs just have more sensitive stomachs and vomit more frequently. However, there are steps pet owners can take to reduce the risk. Keep table scraps, human foods, garbage, other pets' food, droppings, and non-food items like medications, household chemicals, and cleaners out of reach. Preventing access to another pet's food bowl, flavored pet medications, or the litter box can be challenging, so pet parents may need to get creative in finding solutions. Parasite prevention and vaccinations are key to preventing common bacterial, parasitic, and viral infections in dogs. Regular wellness checks and testing at the vet can help catch illnesses and conditions early. While routine wellness testing is important for all dogs, it's especially crucial for elderly dogs who are more susceptible to conditions like kidney disease, liver failure, and various cancers that can cause vomiting. If you need to change your dog's diet, introduce the new food gradually to allow their digestive system to adjust. This applies to prescription diets that a vet might prescribe as well. When starting a new medication, make sure to discuss potential side effects with your vet and know what steps to take if vomiting occurs. If your dog experiences frequent vomiting, or if you have questions about acute vomiting, consider consulting a virtual vet for expert advice. An online vet can help you manage mild vomiting at home. They might suggest options like fasting, a bland diet, or other dietary changes. However, do not fast your dog or abruptly change their diet without consulting a vet first, as this can be dangerous for some dogs and might worsen the symptoms. Vetster is always here for you if you have questions. Thanks for watching. We'll see you online.